Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop myofascial pain syndrome. But before I do that, I'm gonna go over basic anatomy for the fascia system. Then we'll go over the causes, the risk factors for fascia restrictions or causing myofascial pain syndrome. At the end of the video, I will go over the steps that you can take at home to relieve and get rid of myofascial pain syndrome. What is fascia? Fascia is a connective tissue. It's a very thin layer of tissue. You can see it here in this image. It's like a web like tissue here, and you see it here in a cadaver. When we do dissection, you can see it initially, the superficial fascia layer that's wrapping the entire body. It's like a Spider-Man suit that's wrapping the whole body. That's a superficial layer. So it's very thin. It's keep the muscle, the joint, everything in confined up compartment. So the function of the fascia actually to help us to separate tissue from each other, and also it's need to be loose enough so you will have mobility. So for example, let's say this is my fascia. The t-shirt, the shirt I'm actually wearing, and when you have fascia restriction, it's like you're wearing a t-shirt 2 to 3 size too small. So when I try to lift my arm up like this, because it's very restricted and the shirt is very small, it will prevent movement. And that is one of the most important function of the fascia. It keep your body moving freely. It supports your structure, your anatomy. It's actually help with separating the tissue from each other. So you can see it here in the body. There is several layers of fascia. So the superficial layer wrapping the entire body, and we have a layers wrapping a group of muscles. And here it's divided to 2 subcategories, the superficial layer and the deep layer. And the deep layer is actually divided to 4 subcategories. So the first deep layer is the apparatic fascia, and that layer, it's wrapping a group of muscles. Then we have the epimysin that's wrapping individual muscle fiber. Then the premiysin that's wrapping a bundle of fibers, and at the end you have the endomysin that's wrapping each individual muscle fiber. I'm going over this because I want you to appreciate the complexity of the fascia system. So when we go over the treatment, it will make a lot of sense. Why the current treatment that's used by a lot of healthcare providers does not work, and how to address the fascia system properly. But don't worry, the treatment is very simple if you have the right tools. So when we look at this image, you can see the apparatic fascia usually wrapping a group of muscles, but here for each individual muscle here you have the epimysin, the white layer here, and then you have the premiysin that's wrapping a group of muscle fibers, and you can see each individual fiber here. Then you have the endomysin that's wrapping each individual fiber. So when you start to have fascia restrictions, it's like this layer suffocate the tissue. It feels like a band, it feels like a knot, it feels like a rope. And why it's important? Because it's extremely overlooked by healthcare providers for a couple of reasons. One is there is no standardized test to really evaluate the fascia system properly. So that's why I came up with several scales and that I teach to healthcare providers to evaluate it properly. The other issue is the current treatment that's used by a lot of healthcare providers are not effective to treat the fascia system. So a lot of healthcare providers gave up because the current treatment does not work. So it's not worth the evaluation if the treatment is not effective. So the symptoms of myofascial pain syndrome: muscle pain, joint pain, muscle weaknesses. You're gonna feel like a rope or band or a knot inside your muscle when you start to palpate, especially in the trap area. You will have decreased range of motion. As I said, the fascia system, when it's tight, it feels like you're wearing a clothes that's too small for your size. So you're gonna feel like suffocated, or you feel limited range of motion. Also, you're gonna feel like sleep disturbance. So what are the causes and risk factors for myofascial pain syndrome? Well, one of the most common and overlooked causes are poor posture, poor body mechanic. Think about this way: if you maintain poor posture, slouching in the front of your computer or your phone for a very long time, that fascia system is actually start to lose elasticity and confine to that posture that you have. When that happens, it's like you're wearing a t-shirt 2 to 3 size too small. It will limit you from going back to the normal posture. So one of the common things: poor posture, poor body mechanic. Also, you could have fascia restriction from accident, motor vehicle accidents, repetitive strain injury. If you do a lot of activity that cause muscle strain, it's gonna cause fascia restriction. And also, it's overlooked that surgeries actually cause fascia restrictions. When the surgeon cut into the muscle, they actually cut the fascia layer, and that causes fascia restriction and limited elasticity of the fascia system. You need to have enough elasticity or room for your muscle to move underneath the fascia system, and if you lose that, it's like limiting the muscle from moving. Also, stress could cause myofascial pain syndrome, and some of the diseases that actually risk factors like fibromyalgia, rheumatoid arthritis, osteoarthritis, hypothyroidism, those are risk factors of having myofascial pain syndrome. So how to treat and stop myofascial pain syndrome? Before I go over the steps you can do at home to relieve and treat myofascial pain syndrome, we have to understand the normal healing cycle, because it will make a lot of sense why current treatment does not work, and also it will make sense what is the best approach to really address this issue. So our body has to go through 3 stages in order to heal. That's a normal healing cycle. I'm gonna use external paper cut for visualization, but the same process happens internally from poor posture, poor body mechanic, accident, trauma. And you will see, after understanding the normal healing cycle, with any musculoskeletal injury you have, like if you have like knee pain, back pain, headache, migraines, there's always fascia restrictions involved with that. If you have plantar fasciitis, if you have sciatica, if you have carpal tunnel, there is always fascia restriction involved with that. And that's what overlooked by a lot of healthcare provider, that the fascia system has to be treated as part of treating any musculoskeletal injury. So the first stage of healing, as you see here, is inflammation. When you have a paper cut, your blood start to rush to that area. You start to have redness, inflammation, increased temperature, and swelling. The second stage of healing is the proliferation stage. This is very important because this is the stage that your body starts to build the scar tissue, and you can see it here in this image. When you start to build the scar tissue, it's you gluing the fascia system together. And that's what's overlooked, that the fascia is involved with all majority of musculoskeletal injuries, but it should be part of the treatment of any musculoskeletal injury, because it can contribute to majority of the pain that you experience or some of the pain. So when we look at the proliferation stage, you start to have scar tissue, you start to have fascia restriction, trigger point, muscle spasm. So when we treat the body, we don't want to choose only, oh, I'm gonna work on the fascia system, because that sounds like the most common issue. That's correct, but you have to also work on a trigger point. You have to work also on fibrosis, which is the scar tissue, and the inflammation, because each of these elements is actually contributed to the pain. And majority of the patient, they usually not only have fascia pain or fascia restrictions, they also have scar tissue, they have trigger points, they also have muscle spasm, and some of them have severe inflammation that interfere with the healing. So perfect scenario, your body should get to the maturation stage as you see here, and that's mean your body healed. But majority of the patient, they actually stuck between inflammation and proliferation. Your body, the healing cycle going back and forth in that vicious cycle. So there's inflammation, there's fascial restrictions, there's scar tissue, there's trigger points, and muscle spasm. And in order for us to really treat myofascial pain syndrome, we want to release the fascia system, and we want to address any other issue that occur at the same time. There is a good image here I have to show you the effect of scar tissue, and that will make a lot of sense why the fascia system is also affected by the scar tissue. So normal muscles should look like this. The first image, nice and smooth tissue. When you have injury like poor posture, poor body mechanic, accident, trauma, or surgery, you start to have a tear in the muscle, and that tear actually occur also in the fascia layer. So your body as part of healing, and we need our body to build the scar tissue. That's part of healing. If our body does not build the scar tissue, it's open wound susceptible for infection, or if you have an internal tear, it will be permanent tear. We need the scar tissue to glue the tissue together. And when that happens, that's what look like internally, is the scar tissue building randomly in the muscle. But I want you to visualize the same thing here in the fascia system. You get a cut in the fascia system in here. So your body has to build the scar tissue to glue this fascia system. The problem is when you have a lot of scar tissue, those fascia layer glued together and preventing any elasticity or room for your muscle to move or the fluid to move between the fascia layer. To make things more complicated, the fascia system, each layer, like the superficial layer, consists of 2 to 3 sublayers, as you see here, and the apparatic layer consists of 2 to 3 sublayers. So when you build the scar tissue, those layers glue together, so it prevents any blood flow or nerve conductivity, or it prevents the mobility of the tissue underneath it and between it. So that's one of the most important part of understanding the myofascial pain, because we need to understand that when you have injury, it's typically affecting several layers of the fascia system. There is a lot of techniques that use like foam roller or myofascial release that focusing on working on a superficial fascia layer. Maybe they address some superficial apparatic layer, but mechanically impossible with the hand to really go deep to address the deep apparatic layer, the epimysin, the premiysin, the endomysin. And when you have muscle tear or any injury or poor posture, typically you have adhesion and scar tissue in all of these or majority of these layers. And how to tell you have this issue? Well, if you have elbow pain or knee pain or neck pain, just go to the muscle around your neck. Let's try this now, and push down in your trap muscles. If you start to feel there is a bump or a knot or a rope that's there and tightness, that's could be a sign of fascial restrictions and scar tissue, because normal tissue should feel nice and smooth and loose when you touch other area to compare to the tight area. But anatomically, you should not have a rope in the muscle, especially in the muscle belly. You could have feeling the rope feel when you go to the tendon that attach the muscle to the bone, but you should not feel that in the muscle belly. And if you feel it in the muscle belly, that's usually a typical sign of fascial restriction and scar tissue. So I'm gonna go over the common treatment that's used but doesn't work for the myofascial system, and we will understand why this treatment does not work when we look at the fascia system anatomy and also look at the normal healing cycle. So one of the most common things that used in physical therapy, chiropractor, OT, that they use ice and steam and heat, but when you look at the normal healing cycle, that's not gonna do much to the proliferation stage. And based on the studies, actually it provides temporary pain relief for just a few, half an hour to an hour if you're lucky. So it doesn't work based on a study. The second thing that's been used very commonly and marketed in a lot of places, foam roller to release fascia system. It's anatomically impossible with the foam roller, and I will combine it with massage, to release fascia system, because when we look at the anatomy of the fascia system, there's a product fascia that the foam roller impossibly can go deep to get to release that fascia system. The epimysin, the premiysin, the endomysin. And basically rubbing over the fascia layer, that will not release it. You need to have mechanical forces that get to the fascia layer and release it. And impossible with the hand, especially if massage. We learn in the school to use elbow or knuckle to go deep, but mechanically impossible with the knuckle to go deep enough. That's why I invented the A5 to really go deep to the fascia layer, because my knuckle or elbow extremely thick, so it's impossible to go deep to do deep release. And if you don't apply mechanical force on the fascia system, it's impossible to release it, especially when you have a scar tissue there. So that's why foam roller myofascial release does not work, or massage does not work. Why? Because if you, for example, a mechanic, and you need to unscrew a screw in the motor, but you have a very short screwdriver, it's impossible to go deep to really unscrew that screw. You need a long screwdriver or a long tool that can go deep to do the work. And that's why foam roller, myofascial release, or massage does not work, because you cannot exert that force, or you cannot go deep enough. The other thing used is stretching. So think about this way: you have a nod in the fascia layer, and your fascia layer should have some elasticity to give you some range of motion. So when you have a nod and you try to stretch it, that's not gonna release the nod. Actually, based on a study, showed stretching could cause more inflammation. If you overstretch, you're gonna tear the tissue more, and when that happens, you're gonna cause more fascial restrictions, more scar tissue. That's why I don't recommend stretching to any of my patients. In general, I don't recommend stretching at all, because it provides temporary increase in range of motion, but when they did the study, it does not last, because it's not treating the source of the problem. The problem is it actually has a lot of negative effect on the body. That's why I avoid stretching. The other thing that's used by a lot of healthcare providers are the joint mobilization or joint adjustment. And that's used by physical therapists, chiropractor, and a lot of healthcare providers using the mobilization. Reality is, joint never move by itself. But when you think about it, your problem not in the joint actually. Your problem is in the soft tissue. So moving the joint is not gonna do much to the soft tissue. And when we look at the studies, there's a ton of studies show joint mobilization either provide temporary pain relief or no pain relief. There's no long-term effect of joint adjustment. So the other thing that's used is strengthening exercises. And the problem with that, when it's introduced in the wrong time of the healing cycle, it could cause inflammation. So we want to do strength exercises, but I don't like the strength exercise. I like to do function training, which is more effective, and based on the studies, it's actually improve the person function than the strength exercise. The problem is when you have inflammation, the strength exercises will inflame it more, which means you could cause more scar tissue, more fascia restriction. So what should we do at home to really take care of myofascial pain syndrome? We have to look at the body from two aspects: the inflammation stage and the proliferation stage. And we have to address all of them simultaneously, because reality with fascia restriction, there's always a scar tissue. There's always trigger point. Some patients have severe inflammation, some patients have moderate inflammation, some patients have mild inflammation. You cannot pick and choose which part of the healing cycle to treat, because that's not a full treatment. For example, you don't want to go to the mechanic to have your car need a tune-up, and you tell the mechanic just to change the spark plug only, and that will help the improving the performance. It will not, because that's not a full tune-up. That's not addressing all the issues that occur simultaneously in the car. The same thing in the body. We have to look at the healing cycle from all aspects and address each one at the same time, so the body will transition easily to the maturation stage and heal. So what I personally do for the inflammation, rest, avoid the repetitive motion that aggravate it. If you have poor posture, poor body mechanics, we need to avoid those bad posture and bad body mechanics. The other thing I use for inflammation is the MagnaHeal 2. Very strong magnet that the range of the magnetic field about like 3 inches that can penetrate the body, 3 inches to really decrease internal inflammation. I like to put all my patients on the anti-inflammatory diet, because there's a lot of food that could cause internal inflammation and slow down the healing process. So the other thing, that with severe inflammation, you might have vitamins, mineral deficiency, like you need magnesium, you need C, you need collagen, you need water, you need a lot of B's, you need a lot of ingredients in the body, so the body would transition from inflammation to proliferation and maturation. And if you have deficiency, that slows down your healing process. If you have magnesium deficiency or D deficiency, the MagnaHeal will not replace the D or magnesium. You need D or magnesium. If you have inflammation because your diet is inflammatory, we have to address that. One of the easiest way they can do today is actually go to AskASTR.com. It's a free online medical evaluation. The software will help you to figure out possible vitamins, mineral, or hormonal imbalance that could interfere with normal healing. It takes about 5 minutes to answer the questionnaire, and the software will guide you what you should do next. AskASTR.com. So what should else to do at home to really get rid of the vicious cycle of chronic inflammation or chronic myofascial pain syndrome? We have to work on a proliferation stage. We have to work on all of the elements of the proliferation stage. So what I personally do is I use the A3 to release the scar tissue. We have to work on the scar tissue. It's always part of myofascial pain syndrome to have a scar tissue that gluing the fascia system together. So I use the A3 to release superficial scar tissue, and I use actually the A5 to go deep enough to release the deep scar tissue in the muscle and in the fascia system. And the A5 is actually can go deep in the body up to 2 inches, 2.5 inches in the big muscles, and that is actually good option to really do deep release. That's impossible with Myofascial release, impossible with foam roller or massage with our hands, to really dig deep enough to cause mechanical force to release the adhesion. The other thing, we have to work on all the layers of the fascia. Let's go back here. So we have to work on the superficial fascia layer, and we have to work on the deep fascia layer. So what I personally use, I use the A1 to release the superficial fascia layer. For each of these layers, we can release this with the A1. each of those subcategories of the fascia, superficial fascia layer. For the deep fascia layer, I can use the A1 to release the aponeurotic fascia layer, and then I use the A5 to work on the epimysin, premiysin, and endomysin. We cannot pick and choose which layer to release because most of the patient, the adhesion, it actually glue all these layers together to the muscle, and you will feel it when you start to feel palpating, and you feel knot, drop, band that actually cause adhesion in the tissue together. So to sum it up, what you should do at home. Well, first we need to avoid the motion that aggravated or cause myofascial pain syndrome. One of the common things is poor posture, poor body mechanic, slouching in the front of the TV, the computer. We have to correct that. With poor body mechanic, if you do a lot of repetitive motion at work, like lifting and stuff like that, we need to correct the body mechanic. But correcting the posture, correcting the body mechanic will not release the inflammation or decrease the inflammation or release the fascia. What I personally found that's most effective approach to really treat myofascial pain syndrome is initially I start to release the proliferation stage, releasing the fascia restriction, the scar tissue, and the trigger points. Then if there's inflammation, I will address that, so it will be easy for the patient to do the proper posture, proper body mechanic. I don't do it the other way because it does not work. Because when you have a lot of tightness, that tightness actually hinder you and prevent you from having good posture. Even if I train you 10 hours a day to have a good posture, that's not gonna last because you're gonna feel like you're lifting 20 pounds in your back because your fascia is very tight. So I do the release first, release it with the A1, A5, and if there's a scar tissue, we'll use the A3. Then if there's inflammation, I use a MagnaHeal, and then after that, I give the patient feedback to correct their posture, working on the posture and body mechanic. And this is basically how you can address myofascial pain syndrome at home. We'll see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to astrinstitute.com.